A warm welcome to all our viewers to our series Natural Medicine. So I got an email this morning which touched my heart a little. A desperate viewer still has health problems. He can't get a grip on it. It is a Parkinson's patient who suffers particularly badly from his tremor. And these are the shaking reactions. And he's asked me to do a show about it so he knows what to do. Yeah, well, we take that very seriously. It hurt us just as much to read that. So I asked my studio guest, Professor Dr. Thomas Rau, if he'd like and have time to make a programme here for our viewer and on behalf of many, many other patients suffering from the same problem. Just that this tremor shows clear reactions. I'm excited to see what recipes we'll hear today, what our viewer can do. And I'm asking you to stay tuned, and we'll get started right away. And here we are again, and now I may show you my expert, Professor Dr. Thomas Rau. Thank you very much for being here, and thank you for taking the time to address this topic. The viewer has already seen some programmes and he's picked out some of it. He tried to take MCT oil to bring the metabolism to burn fat. But I don't know how his diet is. And he also started with galactose because it goes into the brain very quickly and produces energy that apparently could also have an effect. And now I'm curious, you as an expert, what else can we give him on the way, or does he have to live with it? Tremor, shaking sickness is a very, very big problem. I wasn't that enthusiastic when you brought this subject up to me because, well, first of all, I'm not prepared today, but it doesn't matter because I can talk a lot about it. Secondly, because it is very difficult. There is no simple solution. There just isn't. Tremor has different types. The viewer needs to know that too. Just one type is Parkinson's disease. Oh, right. Yeah, that's the tremor. But there is, and that's the important and hopeful thing about it all, there are many other tremor diseases that are not Parkinson's. Because Parkinson's is very difficult and you have to take chemical medication for a long time. We have ways of diagnosing the tremor symptoms and also to clarify the causes of their effect. And then we just find very different reasons. If the patient now says he took MCT oil or has taken this or that and galactose, well, that's all good. And that's right. But you shouldn't do it that way. I experience this all the time because we get a lot of such neurological patients here. And we also have good solutions for them, but they have mostly already done this and that and so on. CBD is also in vogue at the moment, cannabis oil and so on. That's what's being said everywhere these days. Well, that's not really the right way to do it, because you have to start today. It's like Alzheimer's, although tremor has nothing to do with Alzheimer's, but it is also a serious neurological disease that has to be treated today. Don't just push it away because it increases, and it often increases very quickly or very much if you don't do anything. The causes are, the most common nowadays is toxic exposure. Secondly, the second cause is viral strains. I'm sure you heard that, although the press isn't writing anything negative about COVID today except scaremongering. But in this corona time, neurological diseases and also tremor diseases have increased massively in frequency, and younger people get it. Why? Because viruses, it doesn't just have to be corona. No, it can be other neuroviruses such as varicella viruses, such as Epstein-Barr, although less cytomegally, toxoplasmosis. And this type of virus can also work subliminally. And then the causes add up to each other. So, in the tremor patients, but also in people who get cognitive problems, for example, premature memory loss or things like that, we see that people get it much, much, much earlier today. We do the same causes treatments. In one human, it expresses itself in tremors. Well, what kind of tremor? There are different ones. Very subtle or intention tremor that only comes when you try to pick up a glass, then you're not able to, or resting tremor. And there are various reasons for this. Tremor is not just tremor, and you really need to do that with a biological doctor, not with a general practitioner, because they won't do much toxicology work. Unfortunately. With someone who clarifies it toxicologically and also biologically, this is our staff of life today, these chronic diseases. Tremor is just a neurological expression. A neurological way of expressing a strain on the body, a stimulus. Why is this nerve irritated that it moves excessively and the coordination is no longer correct? And can it be deactivated? The causes are toxic. They are degenerative. You know, that I always go back to the intestines, because the gut lets the toxins through. The gut is very, very important. My great teacher, Dr. Conny Wertmann, this brilliant doctor from Salzburg, he said that every neurological ailment is an intestinal disease, he told me. Is he crazy? But I have to say today, that contributes to it. And we have toxic substances coming into us through the gut. But there are also other causes, namely that protective substances, which stabilize the nerve so that it does not start to tremble for nothing, that these substances are missing. Then we have a lack of certain substances, and we see that very often today. I'm a proponent of low-dose lithium therapy, which can work very well with such ailments. I've had very good experiences with it, lithium aspartate, 10 milligrams, an absolutely tiny dose, but this trace element can then have a nerve-stabilizing effect. When we talk about neurological diseases, do we mean it's always the brain, so the nerves to the arm? But now, where is the inflammatory process, or the problem? Is it in the arm, or in the brain, or can it be both? In the classic, well, they used to call it tremor equals Parkinson's, but that's no longer true today. The greater part of tremor patients are not Parkinson's. These are toxic patients. They have toxic molecules that are released in the body or get into the gut because we have Clostridia, have highly toxic bacteria in the gut. The bacterial toxin can work through, can be neurologically disturbing, or heavy metals. Or if I today test with the toxicological test, then we see arsenic, we see aluminium. Arsenic and aluminium are very strong neuroirritants, which then now comes to the answer to your question, which work that either on the nerve peripherally, so outside, then we have polyneuropathy, that means something is felt that you do not have at all. For example, one has an ant feeling, but there are no ants. Something wrong is sensed. Or the sensitivity in the foot is no longer right. Then the peripheral nerve's damaged or compromised or inflammatorily altered. And with the tremor, it's in the brainstem. The classic Parkinson's patient has basal ganglia degeneration and can produce too little dopamine. So these people are given dopamine, which is super effective, and then the tremor stops. I've already seen that with NADH, that it works then, but only in this case. Yeah, only in this case, NADH, which is like a precursor in the metabolism of dopamine. It can also then work, NADH. The stupid thing is that these tablets only work for a few hours, or not even for a few hours. Then you have to keep taking it. And this is not a causal therapy, just like the Madopa. This is a fantastic tool, dopamine for Parkinson's patients, because they really get a lot better. But this is not a causal treatment. On the contrary, it keeps getting worse and the dose generally needs to be increased. We try to find the causes, and even in these patients, if one really has a toxic or has Parkinson's disease, even then you can have a stabilizing effect with our methods. Because the nerves need alpha-lipoic acid, this oil needs omega-3 fatty acids in quite large amounts. They need a kind of sealing of the intestine, and they need polyphenols. So, substances extracted from vegetables and nuts that can stabilize nerves. You can do so much, but not just one substance. CBD oil or, I don't know what, galactose. I know my dear friend Dr. Mazzetta is the propagandist of galactose. It's fantastic stuff, but that alone isn't enough. Embedded in a whole concept, we also use galactose, of course, but embedded in a whole concept. Of course, that's what Kurt Mazzetta says, of course. But the viewer wrote me that way. And now, well, that's what I enjoy so much. We have such individual things, and you bring them together in a whole concept. Sometimes it's just really not ideal when we as viewers or consumers tinker around and think it's done with 2 or 3 things. What I've never heard of, and is totally logical, is that the tremor can also be caused by toxic stress. And if I never get that out, then this toxic burden won't get any better. On the contrary, it can be made worse by the accumulation of other toxins. That's why the disease gets worse. This degeneration into an inflammatory process because the causes are not treated. And what if he has a toxicological tremor like that, and he's being treated for Parkinson's now? Does it exist, or what does academic medicine do? If he has his tremor now, that would be non-Parkinson related. What we don't know now, that doesn't matter. Even if he gets another treatment, it doesn't matter. But I have cases, unfortunately, which were treated as Parkinson's, and then it was another multifocal degenerative load. And the dosage of the dopamine drugs was just increased. And then came the side effects. Now, also neurological side effects and severe depression. So, these drugs also have side effects. In any case, whether this or that type of tremor exists, It is imperative that the patient undergoes a holistic toxicological, bacteriological, intestinal clarification. Also a clarification as to whether there are sources of disturbance elsewhere, such as tooth lesions. That could also have an impact. Yeah, of course. Also cause a tremor. Yeah. The basal ganglia are very close to the teeth, just a few centimetres from the wisdom teeth, just as an example. And if there are loads, for example, very, very bad amalgam fillings, especially on the back teeth, can cause neurological problems. I see that all the time. Therefore, every patient who comes to me is also examined dentally. So, this viewer from Tyrol would have to make an appointment with a biologically oriented doctor. For example, as you were offering it, how would that work for him? He'll come to you, and now you're going to do all these tests to see what he's got? Well, we're in the fortunate position that we have a large number of registrations because very few clinics can do the same like we offer at the Sonnenberg Clinic in Schwelbrunn, Switzerland. Therefore, we ask the patient to fill out a questionnaire. It's not that big, but then I know roughly what they have. And then they can make an appointment. I'm not a computer person. www.biomed-sonnenberg.com and then they find the questionnaire and then the registration formalities, and then they come to me. Then I already know what they have, and on day one we do the clarifications. Then they go back home. That works as an out or inpatient. Most people come from Tyrol, so we have quite a lot of people who come to us. It's not that far. And yeah, then they can come one day or come several times a day. It works in different ways. And when it comes to detoxification, that's going to be intravenous, yeah? Chelation drainage. Yeah, well, the neurological patient usually has several pillars of stress. One is the toxic burden, and the other thing is the lack of stabilizing substances, nerve stabilizing substances. Both of these will be clarified, and we'll then give them these vitamins, trace elements, or very specific proteins or fats. Fat sounds so negative, but actually there are the important, good fatty acids that the nerve cells need in large numbers and in large quantities. Or we do the detox. And this can all be done on an outpatient basis and with infusions. But also, this is the important thing, long-term with medication. So, with our biological healing substances, can one also give a hopeful prognosis in this show? Can he expect that this tremor will almost stop again? And if yes, if you can make the statement, over what period? How much patience does a person like that need to have? Well, that's a difficult question. How old is the patient? What was his job? Has he had toxic exposures? Yeah, and what kind of tremor does he have? The younger he is, the better the prognosis. Unfortunately, that's just the way it is. The more toxic it is, and we find these substances, the better the prognosis. We have quite a few patients who have completely stabilized or even improved. And so I can't make his prognosis until I actually see him. It's very individualized. Yep, understood. That must also be the inevitable next step. And I hope that this gentleman will visit us after the treatment and tell us about it. And this is important to document. I really have something important to say for people. Neurological diseases must be clarified holistically. This is incredibly important. Most cases today are toxicologically related or deficiency related, and they can be helped not just with medication. Don't just do individual things and think that it works. I keep hearing that word from you and from some other doctors too, but that has not yet become common practice, that fundamentally toxicological examinations are done with patients. Unfortunately not. That's why we have the better results. Now that sounds arrogant, but it really is the case. You mentioned the word toxoplasmosis. I keep hearing that too. That was the Russian scientist who found the connection to cats. And many cat owners don't even know that they are actually infected with this toxoplasmosis. Well, with many people, not only with the neurological, with actually all chronically ill people, we do clarifications on viruses, toxoplasmosis, cytomegalovirus, varicella, and now of course COVID too, then Epstein-Barr, and so on. And it's absolutely terrifying how many people are infected, but subliminally they don't feel it at all. But they have very high antibody levels in their blood. And then you have to deal with that. And so, well, these are all neurological diseases. And today, however, the toxoplasmosis is no longer like the cat bite disease or cat scratch disease. That doesn't really exist anymore. But there are these creeping forms. And under certain circumstances, that can also trigger a tremor, among other things, yeah. So I wanted to write back to the gentleman from Tyrol. So now I've done it better, because I have an expert here. I would have written to him that until his appointment with an expert, he should maybe put omega-3, Q10 and NADH under the tongue in the hope that there will be an immediate improvement. But, of course, only for a limited time, for 3 or 4 hours. Is that something I can write to him? You can write that to him. Yeah, but it's also a separate advice. No cause. Exactly, but these substances are usually not mentioned and have an effect on their own. So I can write that. Yeah, you can write that. But he absolutely has to do the toxicological investigation. I can't do more than a show about it, so dear gentleman from Tyrol, I hope we're able to make you very, very happy. You asked me to name you an expert? I did it differently. I discussed the topic right away. And now it is, of course, up to you to take the next step. And for all viewers who also know people who have a tremor, just let us tell you, today there are various causes behind the tremor, and far from just Parkinson's. But very often, toxic loads, substances that simply accumulate in our body over decades with an unbelievably number of effects, and that's ugly. And I've learnt a lot. I can say that right now, very proud to be learning something again. And I thank you very much. That was Professor Dr. Thomas Rau for you. Dear viewers, and I wish you all the best. See you next time.